Hello everyone. Today I'm going to be talking to you about relearning and reteaching healthy singing following musculoskeletal trauma and injury. And today's topics that I'm going to go ahead and cover are my personal account and my why. So we will be having some story time. Effects of pain and trauma, whether that be mental, emotional, physical, etc., and how those affect our singing. The muscles that are involved in inhalation and exhalation, and then some solution suggestions. So on March 28th, 2021, I was in a car accident when a man fell asleep at the wheel and hit me going 80 miles per hour while I was sitting in my parked car without a seatbelt on. I sustained life-changing injuries. I fractured my spine. I had splenic bleeding. I tore my left rotator cuff and I fractured my right collarbone. I had also been in a head-on collision when I was 8 years old, and I endured whiplash, tearing the ligaments in the back of my neck, causing my sternocleidomastoid and scalene muscles to overcompensate. Those are accessory breathing muscles that I will go over more a little bit later, but this caused a substantial amount of muscle tension in the throat and the loss of curve in my cervical spine. So the second automobile accident exacerbated the first, and something that happened in a split second changed my life and possibly my career path forever. I honestly didn't realize at the time how much these injuries would affect me. I thought, after all, I've never had nodes. I've always used healthy singing and speaking technique, or so I thought. When the pain isn't acute anymore, I should be fine. So we know as singers that our whole body is our instrument, from the top of our heads to the soles of our feet, and it's not just our vocal folds. But the first time that I tried to sing a classical piece of music after the accident, I was hit with not being able to sing like I used to. And something that was more conceptual for me before became deeply tangible when we talk about our whole body as our instrument. So in my enlightenment, I became profoundly aware of the reality that this type of pain, acute and what would turn chronic, would be one of the most physically, mentally, and emotionally challenging and exhausting things I've ever experienced. And I felt like it attacked my singing from every angle: physical, mental, emotional, and spiritual. And I felt like I had lost everything, and my gift and all these years of practice and education and time invested had just been ripped away from me. So, as with anything, healing for this was not linear and is not linear. And unfortunately, there is no physical therapy for learning how to sing again with musculoskeletal trauma like this that's openly and readily available. Any research that has been done on this topic is very few and far between. We know how to treat vocal injuries such as nodules, polyps, etc. We have speech pathologists and ENTs to help us walk down the path to healing these things. And we can physically see what's going on with a scope and how it's directly affecting our speaking and our singing. However, when it's the whole body or specific parts of the body, how do we as voice teachers help each person specifically? How do we help ourselves if, God forbid, we endure personal trauma of this nature? As vocal pedagogues, we're used to having, tailor-made lessons for each of our students. But when the student knows what to do technically, but their body will no longer do it, where do we go from there? Compassion is key, but what are the practical steps to solving these issues? How do we move forward with confidence so that we also encourage confidence and hope in our students? This is one of the reasons I'm so passionate about being well educated in the anatomical and physiological side of the voice and the entire body, as well as the artistic, emotional, and spiritual side of singing. So given all of that information, that is why I did my research on how to relearn and reteach healthy singing following musculoskeletal trauma and or injury, especially in the areas of musculature that assists in inhalation and exhalation. And we're going to do this through bodily realignment and the balance of tension and relaxation in the body. And I wanted to focus on this topic to bring awareness to such situations, and also in hopes of not only healing myself, but allow this experience to help others who are going through something similar and prepare others as teachers if and when they have a student going through this. Kinesthetic empathy is a very powerful thing. And I believe being able to relate and connect in that way whilst also having problem-solving knowledge and instincts on how to move forward can make a massive, massive difference when working with singers who have had the experience of this type of trauma. So what is the result from the type of pain that comes along with these injuries? So pain from such injuries can raise one's blood pressure, it increases the breathing rate and the heart rate, and it can cause muscle tension, leading to fatigue and psychological issues, which all affect the quality and sensation of singing. I think we've all experienced that at one time or another, whether we've been injured or not, and we know just how much of an impact something like that has on us as performers. In my personal experience and my own journey, my spinal fracture occurred in my T8 vertebrae, which is located in my mid-back, right behind my rib cage and my lungs. And because the facet joint on the T8 vertebrae is attached to the ribs and the fracture was uneven, it caused my entire rib cage to shift, making me feel very crooked and lean more to my left side. This trauma caused my external and internal intercostal muscles to feel both weak and tight simultaneously, making even natural, normal breathing difficult. Like we talked about in the Naked Voice book that we had studied, breathing should be very natural, but when you've had trauma to that part of your body, nothing is normal and natural anymore. I also have to fight the urge to have a rounded back and a concave chest. Consciousness of proper physical alignment is essential as a vocalist, and we know that. But what was once natural to me and most other singers with this experience now has to be fought for every single day. And it's knowing what muscles to strengthen and what muscles to stretch out and relax. Just having that balance of tension and relaxation. So when you're working with your students that have gone through this, just know that it is like singing in a brand new body. What worked for them before may not work anymore. Like for me, instead of deep belly and back breathing, now I realize sometimes breathing a little higher in my chest, having like some clavicular breathing, which we usually we think is a big no-no, actually helps my singing instead of hinders it because I want to open my chest more. So it's kind of about throwing out anything and everything and trying everything out just to see what sticks. So another thing that this type of pain also affects is things like memorization of music, because cognitive function is compromised. So in a behavioral neuroscience article, it was stated that chronic pain is a debilitating condition associated with biopsychosocial consequences. Subjective reports by chronic pain patients and objective empirical research have demonstrated that chronic pain is associated with cognitive deficits in various domains of functioning, including attention, working, memory, and executive function. It also goes on to say that it's been shown that there is a complex relationship between the psychologic stress response and chronic pain symptoms. And unfortunately, treatments for chronic pain are woefully inadequate and often worsen clinical outcomes. So developing new treatments and strategies for patients with chronic pain is of utmost urgency. So just to give some context, because we are focusing on the areas of musculature that assist in inhalation and exhalation, there are a lot of muscles involved. When I started doing my research on this, I was actually blown away. Most of my family is in the medical field. Both of my parents, my grandparents, like all of my immediate family. And so my stepdad's a chiropractor. So we've had all these pictures of the human body and all of, the muscles and everything like hung up all over our house for my entire life. And I never realized that all of these muscles go into breathing. So I'm going to go over this. I have it on my presentation as well, just in case you are a visual person. So you can see where they're at. But the primary inspiratory muscles are the diaphragm and the external intercostals. So relaxed, normal expiration is a passive process, and it happens because of the elastic recoil of the lungs and surface tension. However, there are a few muscles that help in forceful expiration and include the internal intercostals, intercostalis, intimae, subcostals, and the abdominal muscles. The muscles of inspiration elevate the ribs and the sternum, and the muscles of expiration depress them. The accessory inspiratory muscles are the sternocleidomastoid and the scalenus anterior medius and posterior, which is what I was talking about before in the neck that I have a lot of problem with, the pectoralis major and minor, the inferior fibers of the serratus anterior and latissimus dorsi, the serratus posterior superior may also help in inspiration, and as well as the iliocostalis cervicis. Yeah. So technically, any muscle attached to the upper limb and the thoracic cage can act as an accessory muscle of inspiration through reverse muscle action or muscle work from distal to proximal. So the accessory expiratory muscles are the abdominal muscles, so the rectus abdominis, the external oblique, internal oblique, the transversus abdominis, and in the thoracolumbar region, the lowest fibers of the iliocostalis and longissimus, the serratus posterior, inferior, and the quadris lumborum. The accessory muscles are recruited during times of exercising because of the increased metabolic need and also during dysfunction in the respiratory system. So I'm reading all of this and I'm like, okay, nobody usually thinks much of the accessory breathing muscles. However, after all of my personal experience, they can cause a lot of problems if they're too tense or they're too weak. And being aware of these muscles is key for somebody who has had musculoskeletal trauma in these parts of the body in particular, or if these parts of the body are overcompensating for the other injuries. So when we think of trauma, usually dysfunction goes hand in hand with that, as well as the fact that when you are singing in an opera or musical theater where there are times when you're moving around a lot or dancing and there's an increased metabolic need, it is like exercise to an extent. And so the accessory expiratory muscles can be getting used, as well as, if we're wanting more air pressure and we're like pushing those notes out, which, sometimes a lot of the time is not healthy. But sometimes if we're fatigued or whatever it is and we're using more pressure, we'll be using these accessory muscles. So my friend and colleague, Jennifer Molodou, did some very insightful research on recovery of singers with orthopedic trauma, including practical steps on alignment, breathing, and meditation, and even goes into the psychological aspects and post-traumatic stress disorder and recovery, which I think is really, really important because singing is such a holistic process. But one of the solutions she offers in her dissertation, and something that really stuck out to me, is the meditative breath. And I found her experience with it quite eye-opening. I have meditated before, but I had never thought much about the breath while doing so, which kind of seems silly now because I know in most practices it's all about the breath. But for me, when I was doing it, it was always more about quieting my mind and trying to achieve really intense focus. So in her dissertation, she states, when I focus on a meditative breath while singing, my entire body releases, particularly in the thoracic and lower abdomen. This release, in turn, causes me to relax my facial muscles, my jaw, and my shoulders. By focusing on the unhurried inhale and exhale, I do not feel as if I am supporting or controlling, but instead managing the breath. And as a result, the onset is balanced and unanalyzed. So what she says makes so much sense to me. And after giving it a try, I was able to focus more on the breath and less on the pain, creating space for me to inhale more naturally and not automatically taking in a sharp breath, which obviously will always lead to tension. Trauma and pain causes the body to automatically want to contract and tense up, and not to mention people who feel like they're singing in an entirely different body typically get more nervous than usual to perform, because when we talk about confidence, repetition is what breeds confidence, and, familiarity breeds confidence. So when you're not used to your body, or it feels chaotic and inconsistent when you're singing and you don't know what to expect that day, it can be scary. So anxious energy may be present. I think, even our normal bodies, when we haven't experienced trauma, we don't know what to expect that day. Like, we might have eaten something different that morning. We might be on our periods, like whatever it is. It's, you're not going to sound exactly the same every single day. But with this, it's even more chaotic and inconsistent in my experience. So this will cause, that anxious energy, and that raises the heart rate and leads to quickened breathing. So meditative breathing can be one of the top solutions in recovery. So other things that I've found on my own to help are consistent massage therapy, if you're comfortable with that, including cupping. I love cupping. So that separates the tissue from the fascia, and it really helps to loosen those tight muscles that won't release with just stretching alone, or just like regular massage. Gentle chiropractic work, if the injured singer is able to, even just like a TENS unit, which basically is like kind of like little electrodes that like shock you and then they release the muscles. So it helps to, again, release the tension in those muscles. An ultrasound machine to gently relax muscles, or an activator tool used by a trained professional also helps a ton. Using a far infrared sauna, which in my experience and after reading about them, is better than a regular sauna, because instead of heating you from the outside like a regular sauna does with hot air, which can be, if you're claustrophobic, it just is a lot. It can be a lot. So it heats the body from the inside out with full spectrum wavelengths, and it actually gets down to the cellular level. So some specific benefits that contribute to our topic is that it promotes better sleep, which if you're super fatigued, better sleep is great. Relaxation. So for the muscles and even for the mind, that's great if you're anxious and for those tense muscles. Detoxification, relief from sore muscles, relief from joint pain such as arthritis, and then clear and tighter skin, improved circulation, and help for people with chronic fatigue syndrome. And other benefits which can indirectly benefit you are weight loss, and the clearer and the tighter skin and things like that. So this next thing can be kind of a sensitive subject. So I don't know. It kind of depends on the relationship that you have with your student to talk about this. But if you don't want to talk to your student about it, this is something that if you're going through this, that it can personally help. But changing up your diet, and going to a doctor, like a functional medicine doctor or a naturopathic doctor, and getting some blood work done first to see like what you're allergic to and all of that. But if you change up your diet and you get supplements to support joint health and eat foods that are anti-inflammatory, that has helped me a ton. And then things like some light exercise that supports the singer's injuries. So for me, that's walking or swimming, not all types of swimming, obviously, because of the rotator cuff types of things. And the Stairmaster because it's low impact. I also love Pilates and yoga. I've found yin yoga specifically to be extremely beneficial because not only does it encourage the body to stretch and relax by holding relaxed poses for several minutes at a time, but it also increases mindfulness and is very meditative as well. I have minimal personal experience with the Alexander technique, so Dr. Headland, I'm sure, can help us more with that. However, we used to do sessions of that in my undergrad when I was at Manhattan School of Music before the accident, and I loved that it's gentle, and it's a gentle approach to help re-educate the mind and the body to use muscles more efficiently. And I love that the relationship between the head and the spine is such a large focus of the Alexander technique, especially when it comes to muscles of inspiration and expiration. Something else that's kind of similar is the Feldenkrais method. It's also a wonderful tool to promote body awareness and is thought to improve body movement and the psychological state by focusing on dormant muscle groups or muscle groups that we don't think much of, and we use mostly subconsciously. Another thing that's been really helpful, in my opinion, is SOVT or semi-occluded vocal tract exercises. And I think those are great for every singer. But when you're recovering from a major body change, whether it's injury, pregnancy and birth, surgery, or something like nodes, I have found that SOVT releases a lot of tension. Many of my teachers and colleagues have also had great success with SOVT, and some examples of these exercises, as I'm sure all of you or most of you know, are humming, straw therapy, and lip or tongue trills. And some ways that you can use them are slides, glides, sirens, basically any pitch from low to high and high to low, octave leaps, arpeggios, scales, as a warm-up, as a cool down or a reset button. You can sing rep through a straw or alternate every other exercise or phrase with the straw, etc. So there's so many different ways that you can use those, and it's just cool because it's so gentle, and it kind of reteaches us how to, I guess, have like the proper amount of pressure without tension. So to be completely honest with y'all, I hadn't learned how to use a straw until maybe like a week or so ago. But like properly. But it's been a game changer as long as it's done properly. So when I tried it on my own without proper guidance, I actually created more pressure and therefore more tension. So when you do use these SOVT exercises with your students, just make sure that they're doing them in like a healthy way, because I've definitely been on both sides of it. Anyways, in closing, there's so much more to be said. This research is still ongoing research because there's not much out there that is cohesive and specific to professional singers that's also readily available. This topic is extremely complex, and each person is going to be different. One thing might work for one vocalist that won't work for a different vocalist. And I did this research in hopes of validating, encouraging, and finding solutions for others who are still working through trauma and relearning to pursue the gift and passion of singing. The resilience that's achieved by working through such trauma is beautiful and inspiring. And with proper guidance and healing, may it no longer feel like an open wound, but be worn as a battle scar as part of our singing journey. A reminder to ourselves and to others in whatever challenges we face as singers, whether it's physical trauma or other, by not giving up, allowing it to control us or steal our passion and love for music, we can be overcomers too. Thank you.